Good morning, good afternoon, good evening, depending on where you are. I would like first to thank the opportunity to present some aspects on the implementation of COVID-19 vaccine in Latin America. I have no disclosures. COVID-19 has reached the world globally as an unprecedented public health emergency, and Latin America has been severely hit by COVID-19 with rapid spread of the disease. In addition to the dramatic high mortality rates and shortage of supplies, Latin America also faced unfavorable political polarization and substantial diplomatic and financial struggles to gain access to vaccines. Nevertheless, despite being one of the most unequal regions in the world, South America has been able to immunize a high percentage of the population, thanks to cultural factors, economic needs, and wake-up calls. Worldwide, South America now leads the world in terms of percentages of the population vaccinated. South America started offering boosting shots as well in August 2021 in a few countries. So far, 42% of the population in South America received a booster dose, the highest percentage of booster administered worldwide. South America vaccine success story is a multifactorial one and varies from country to country, but it's also possible to trace some common factors. These include a deep-rooted culture of vaccination and respect for health systems that still serve the public, however fragile and weakened they became during the pandemic. In addition, Latin American economies also have very high rates of informal, precarious labor. So high vaccination uptake is also combined with the basic need to go out and earn money to survive. Now, I will review more in-depth data from Brazil, South America's most populous country and one of the most unequal countries in the world that reached wrenching records during the COVID-19 pandemic. Brazil has the third world largest number of confirmed COVID-19 cases and ranks second worldwide in the number of COVID-19 related deaths, despite representing only 2.7% of the world population. 6 and 11% of all COVID-19 cases and deaths respectively occurred in Brazil. With one of the largest universal free-of-charge public health systems in the world, Brazil had a distinguished track record of vaccination and disease control. The Brazilian National Immunization Program, coordinated by the Brazilian Ministry of Health in cooperation with state and municipality health departments, is a major strength of our health system, enabling the implementation of highly relevant health interventions, benefiting from the 36,000 vaccination rooms in over 5,000 Brazilian municipalities. This allows for high-speed vaccination if vaccines are made available. When it comes to COVID-19 vaccination, however, the situation was very different. Brazil started vaccinating against COVID-19 in January 2020. Constant delays in supplies and vaccine importation, as well as problems in national production and non-approval of other vaccines, impaired an adequate vaccine rollout in the country. Worldwide, countries with early vaccine rollout largely mirror those with vaccine production capacity. Despite the challenges, Brazil now exceeds the world average in regional average percentage of vaccination coverage. The capability for self-sufficient domestic vaccine production in Brazil has allowed public laboratories to locally produce the main strategic vaccines for the country. The combination of a robust vaccination system and the domestic production allowed Brazil to accelerate vaccination and reach a high percentage of the population completing the initial course of vaccine. Nevertheless, as the number of cases and deaths wane, there are many difficulties to complete the recommended regimens in the country. Adherence to booster doses has been poor overall. Although the first booster of the vaccine has been made available for all adults in Brazil, the peak of boosters administered was by far lower than the observed from the second dose of the initial regimen, and the numbers are decreasing. A similar situation occurs for the second booster. Adherence to the first booster had peaks higher than 200,000 doses administered per day in 2021, but the mean number of the second booster peaked at 92,000 doses per day maximum and is already declining, even prior to its availability to the entire population. Science was able to exceed its own limit in an impressive task force to obtain an efficacious vaccine against COVID-19. Nevertheless, the COVID-19 pandemic underscored the many inequalities around the globe. The case of COVID-19 vaccination in Brazil shows how a robust vaccination program and the national manufacturer capacity may overcome the challenges faced in a pandemic, even in an adverse context. Access to vaccines against pandemic disease should be considered a human right. Thank you very much for your attention.